This is Takoa Rogers, FNP, dictating a visit note for patient, capital A-L-I-C-E, capital T-A-Y-L-O-R. Today's date is 10/7/2018. The date of visit, 10/7/2018. Chief complaint: I'm having a lot of shortness of breath and a rapid heartbeat. Miss Taylor is a 25-year-old white female who presents to the office complaining of shortness of breath and a rapid heartbeat. She also states, I first noticed the problem when I would be doing something as easy as walking up one flight of stairs and find myself out of breath and my heart beating very fast. This has been going on for approximately 6 months now, but seems to be worse because I am pregnant. Miss Taylor reports that this issue started 6 months ago and occurs daily and has worsened due to recent pregnancy. She also reports difficulties with weight gain and intolerance to heat and feeling warm with flushed appearance. Past medical history. There is no known surgical history, no known allergies, current medications. She takes an aspirin PRN for headaches. Immunizations are up to date. Social history. She is a homemaker and is married. She denies ever smoking, denies alcohol or substance abuse, and daily chores have sufficed as exercise until recent issues with increased exertion. Family history. Father and mother are still alive. The father has no medical history. Mother has a history of hypertension. One brother has hypertension and the other has no medical issues. Both paternal grandparents have heart disease, and the father's brother and sister have a history of cancer. Review of systems. Miss Taylor denies fever and chills and night sweats, but complains of heat intolerance. HEENT. Infrequent headaches are relieved by aspirin. She denies any vision loss or ringing in the ears, denies any nasal congestion, complains of blurred and jumpy vision and eyes being bloodshot during the AM awakening. She denies any drainage from her eyes or ears. Respiratory. She complains of shortness of breath increasing over the past 6 months, denies any nocturnal dyspnea, denies any wheezing or abnormal breath sounds. Cardiovascular. Increased heart rate with activities such as stair climbing, complaints of being flushed all over, but denies any chest pain. GI. Complains of increased appetite and having to eat every 2 to 3 hours to prevent shakes, but no significant weight gain. Complains of nausea and vomiting after several hours of eating, but it worsens after skipping a meal. Denies any changes in bowel habits. GU. Denies any dysuria, burning, or pain. Positive pregnancy with last menstrual period noted 4 months ago. Musculoskeletal. She denies muscle cramps, denies any muscle soreness, and denies gait disturbance. Skin. She denies hair loss, denies changes to moles, and complains of skin feeling flushed at times. Endo. She denies any polydipsia or polyuria, complains of heat intolerance. Hematologic. She denies any anemia. Neurological. She denies any convulsions or epilepsy. Psych. She complains of irritability that for the last 4 months, but denies any suicidal thoughts. Objective data. Vital signs. Blood pressure is 116/72. Heart rate is 140. Temperature is 99.6. Respiratory rate 16. Height is 5 foot 10 inches. Weight is 122 pounds. Physical exam. Miss Taylor is an alert, well-developed, well-nourished female who appears her stated age of 25 and is in no acute distress. She is quite friendly, cooperative, and well-oriented. HEENT. The head is erect in midline. The eyes are symmetric in size, shape, color, and position. No scars, erythema, or growths are noted on the lid or conjunctiva. The cornea is clear. The pupils are round, equal, and black. Conjunctiva is moist and without discharge. There is a 2 mm sclera seen at the top and the bottom of the limbus. The patient is able to follow the examiner's finger in all the cardinal directions of gaze with no evidence of disconjugate gaze. The patient is not aware of any double vision during this procedure. A slight lid lag is seen on downward gaze. No nystagmus is seen. The nose is symmetric and without apparent deformity. Nasal mucosa is pink and moist. The septum is without deviation and without polyps. Turbinates are bluish and moist with a clear passage between them. There is no nasal discharge noted. The ear canals are clear and the drums are intact with a bright cone of light in the pars tensa. The malleus is visible through the drum. There are no concretions nor apparent thickenings in the drum. The patient is able to swallow in a rapid sequence with no difficulty or regurgitation. When the posterior pharyngeal wall is stimulated on both the right and left side, a gag reflex is elicited that is symmetrical. The posterior pharyngeal muscles move symmetrically together in back of the pharynx, and the uvula rises symmetrically. The patient notices equal sensation on both sides of the pharynx. The tongue is able to protrude from the mouth, and the patient can fully open and close her mouth, and there is no tenderness, swelling, or deformity over the temporomandibular joints. There is no click or crepitation noted. Strength is good on opening and closing, and the jaw is symmetric. Neck. The trachea is symmetric in the midline and mobile. Internal jugular pulses are noted to 2 centimeters above the sternal angle, with the patient's head, neck, and trunk elevated at 30 to 45 degrees, with the head of the patient in the midline position or slightly turned to the opposing side. The thyroid is markedly enlarged, measuring approximately 6 centimeters, with each lobe and a normal prominent isthmus, with the weight of the thyroid estimated at approximately 100 to 120 grams. No tenderness is noted. Rise with the trachea is noted upon swallowing. A palpable bruit is noted in the right subclavicular area. Carotid pulses are bounding. A diffuse bruit is heard throughout the neck. Forward flexion of the head onto the chest is easily performed when the patient is lying down, and the chin can touch the sternum with no limitation or pain. The patient is capable of laterally rotating her head against resistance by the examiner, and the sternocleidomastoid muscles are strong symmetrically and seem to be full bilaterally. There are no crepitations noted with neck movement. Cardiovascular. A loud S1 and loud S2 are heard. There are no diastolic sounds. The pulse rate is regular, has a rate of 140 beats per minute, and there is no variation in amplitude from beat to beat. Respiratory. Upon auscultation, the breath sounds are readily heard throughout the lungs. They are symmetric and vesicular, with inspiration being longer than expiration. The breath sounds are low-pitched and of soft intensity. No adventitious sounds are audible. GI. On auscultation, clicks and gurgles are heard 10 to 15 times per minute, and there are occasional borygmi. No hums, bruits, or friction rubs are heard. A low pelvic mass, the size of a large grapefruit, is felt upon palpation. There is no tenderness on light or deep palpation. There is no referred pain or rebound tenderness. The skin is noted to be quite warm upon touch. The gallbladder is not palpable. The liver edge is palpable on deep inspiration. It is smooth and non-tender. And there is no referred pain or rebound tenderness. And it is noted that the skin is quite warm. GU. The bladder is non-distended and non-tender. Musculoskeletal. Active and passive range of motion is full and without pain. There is no crepitations on joint movements. The muscle strength of the biceps and triceps is graded 5 on a scale of 0 to 5. On palpation, the patient's muscles seem to have a normal consistency and tone. No areas of tenderness are noted. There are no crepitations or contractures, and the strength is equal and strong. No muscle atrophy, swelling, subcutaneous nodules, or skin changes are noted. There is no obvious joint swellings, deformities, or edema. The patient's fingernails are smooth and shiny, neatly trimmed, transparent, and normally curved. Examination of the outstretched hand does reveal a fine tremor. There is no heat, tenderness, or soft tissue thickening over the spinous processes. There is no tenderness over the spinous process or the paravertebral or trapezius muscles. Skin. The skin is noted to be quite warm, and palms are also noted to be sweaty. There is even color in hair distribution. Neurological. The biceps of the left and right and also triceps reflexes are 3+. Knee reflexes are 3+. Ankle reflexes are also 3+. Psych. The patient answers all questions appropriately. Lab findings. CBC. The hemoglobin is 16.0. Hematocrit is 45.0. WBC is 8,900. TSH, none detected. T4 is 42.7. T3, 550. Ferritin, 100. Based on the findings in labs, the diagnosis for this patient is hyperthyroidism in pregnancy. The plan is to start the patient on propylthiouracil 100 milligrams PO/TID. The patient is educated on diet and to avoid herbal supplements as well as any type of sushi that has seaweed. She's also educated on a medication regimen, the purpose, and side effects. She was counseled on possible depression after treatment with the medication and referred for individual counseling. The patient is instructed to follow up with an obstetrician for ultrasound and pregnancy care, also referred for a consultation with an endocrinologist for her thyroid disorder, as well as a referral for a consultation with a cardiologist for her tachycardia. She is to follow up in 4 weeks to determine effectiveness of the medications as well as needed titration. Thank you.